So 6 medications that are typically required in a medical emergency cart as per the Nova Scotia Provincial Dental Board guidelines. So medications we require are epinephrine. Epinephrine comes in one of 2 forms. There's an EpiPen and there's an ampule of epinephrine. The ampule of epinephrine comes in 1 milligram per ml. Here's a demonstration of how to use an epinephrine pen, an EpiPen. You remove it from the case. Remember, blue to the sky, orange to the thigh. So we're gonna remove the blue safety capsule. You take your EpiPen and you're gonna swing it into your thigh, hold for 2 seconds, 1, 2, and release. Now the patient has been administered the dose of epinephrine. This is called an ampule. The medications that we have in our crash cart that are stored in an ampule are naloxone and epinephrine. Epinephrine is a mandatory drug in your crash cart. How to open an ampule? An ampule is glass, it's completely sealed. Typically when you get an ampule, there's solution in the top of the ampule. There's 2 ways to get rid of that in the ampule. One is to flick it and it drains. And the second way to get it out is to grab it by the tip and give it a shake downwards, and then it comes out of solution. Where you're breaking the ampule is right around this blue line here, which has been previously etched so that it's weak. You grab the top with 1 finger and you squeeze and the top opens just like that. You can draw your drug up with a syringe and then ensure that the ampule is discarded in a sharps container once completed. Next medication is nitroglycerin spray, which should be administered 1 pump under the tongue as required. Next medication is oral diphenhydramine. Diphenhydramine is provided in 25 milligram capsules. You can take 25 to 50 milligrams. There is also an intramuscular version of diphenhydramine that is available. The next medication is acetylsalicylic aspirin. These are 80 milligram tablets. Ensure that you have tablets that are non-enteric coated and to use them, chew, swish, and swallow. The last medication, or the second last medication to be used in a crash cart is salbutamol rescue inhaler for asthma. 2 pumps as required. And the last medication is oxygen. Oxygen is arguably the most important of the medications on your crash cart and should be used for most emergencies.